Hi everyone, today we are going to talk about the 24-hour recall dietary assessment. The 24 hours recall is defined as a type of dietary assessment that involves recalling, describing, and quantifying the intake of each food and beverage consumed by a person in the past 24 hours. This is to evaluate his or her nutritional status. The client has to list out clearly what food or beverage was consumed in the past 24 hours, the portion size of the food, how was the food prepared, and how was it served. By way of illustration, at 7 o'clock in the morning, the client had the first meal, which included 2 slices of toasted white bread manufactured by Gardenian Bakeries, spread with 3 tablespoons of homemade strawberry jam. The client also consumed 2 hard-boiled eggs added with pepper and a glass of whole milk. In this case, the client has to list out every information in detail, including the ingredients used to make the strawberry jam as well as the seasoning used such as pepper. Meanwhile, the client is necessary to record each of the food and beverage consumed throughout the 24 hours, including lunch, dinner, and even snacks between meals until 7 o'clock of the next morning. Upon collecting the data reported by the client, the healthcare practitioner is able to estimate the nutrients and energy intake of the person by using diet analysis software. From here, the healthcare practitioner will assess the nutritional status of the patient. 24 hours recall can be said as the most common diet measurement method as it is inexpensive and is quick to administer, which can be completed within approximately 20 minutes. Besides, it does not cause a burden on the client as it only requires short-term memory without the need for keeping a record of food consumed daily. Nevertheless, 24 hours recall does not indicate the usual nutrients intake of an individual as the client may have attended on a special occasion during the past 24 hours. As it relies on the memory of the client, there might be chances that the client withholds or alters the information due to poor memory. There may also have some clients who may feel embarrassed or intended to impress the interviewer. Hence, they tend to underreport or overreport the food consumed, and this may cause a significant impact on the accuracy of the result. Therefore, the most important thing during this assessment is that the client should be honest as this is a subjective assessment and the healthcare practitioner can only do the further analysis according to what the client has reported. Along with it, an accurate estimation of the portion size is also a crucial element in self-reported dietary intake. Hence, this is usually supported by various instruments prepared by the healthcare practitioner in order to help the patient to recall the food consumed. These instruments include food models, stacking of the cardboard, photographs of actual food, 2D images, as well as household serving size aids. As an extra, 24 hours dietary assessment leads to consideration for certain groups of population such as the young person, the person with recall problems due to old age or cognitive impairment, person with impaired vision or hearing, as well as the person who cannot read well. For the young children aged below 8, the children would be encouraged to carry out the interview in the presence of parents. Besides that, for the person with a recall problem and hearing impairment will be helped through the use of instruments as aforementioned previously. Last but not least, tape recordings, radio, and telephone can be used to communicate with those who have impaired vision, whereas the use of digital imaging methods or web-based systems are useful for those who are not able to read well. Before the end of this video, the summary of what we have learned in this video are the preparation and procedures of 24 hours dietary recall, the props used to estimate the portion size of the food, and extra considerations for certain groups that are physically challenged to participate in this assessment. That's all for the video and thanks for watching.